Okay, so I've been asked to do a quick little video on acute coronary syndrome. And what you don't see on the infographic up at the top is ischemic heart disease, because everything I'm going to cover in this video falls under that umbrella of ischemic heart disease. So up at the very top, we have stable angina. It is considered ischemic heart disease. Angina meaning chest pain. Stable means exactly what it sounds like. It's stable. This is not a medical emergency. This is chest pain that is brought on by exertion. It's brought on by physical activity. So the patient would, in other words, say, I was climbing upstairs, or I was out working in my garden and I had this really bad chest pain, but the chest pain is relieved with rest, with stopping that activity, or with nitroglycerin. So there is ischemia to the myocardium, but it is relieved with rest or nitroglycerin, and that is stable angina. So moving down to acute coronary syndrome, this is another umbrella term for these three things: unstable angina, non-STEMI, and STEMI. So with unstable angina, we're going to start off talking about the etiology. So the etiology of unstable angina is a non-occlusive coronary thrombus. So there's a blood clot in a coronary artery, but it's non-occlusive, meaning that there is still some blood flow getting to the myocardium through that coronary artery. The patho is ischemia, right? This is all ischemic chest pain. So blood flow is not getting to the myocardium, and that is what is producing the pain. The key features are chest pain that occurs at rest, and it is unrelieved by medication, okay? At rest versus during physical exertion with stable angina, okay? And also this chest pain is not relieved by rest. It's not relieved by medication. So it is unstable. It is a medical emergency. Labs, we are going to see normal cardiac enzymes with unstable angina. Moving on to non-STEMI. This stands for non-ST elevation MI, or myocardial infarction. The etiology is an incomplete occlusion by coronary thrombus. So there is a thrombus, there is a clot within a coronary artery causing ischemic pain, but the occlusion is incomplete. So the features: chest pain, again, dyspnea, diaphoresis, all those classic features that we associate with myocardial infarction. But here's what's different. There will be possible ST depression on the EKG, on the ECG. So this is where your ST segment is a little bit, falls below the isoelectric line, and that indicates ischemia. ST depression indicates ischemia. So finally we have STEMI. So with a STEMI, there is complete occlusion by coronary thrombus. So this is the one that is the worst. If you had to pick of any of these things to have, this is not the one that you want to have. So this stands for ST elevation MI, or ST elevation myocardial infarction. So again, there's ischemia to the myocardium, which produces the chest pain. The features are obviously chest pain, dyspnea, diaphoresis. We will have elevated cardiac enzymes, but on top of that, we will see EKG changes. We may see them in the form of ST elevation or a new left bundle branch block. So ST depression, think ischemia. ST elevation, think infarction. So a STEMI or an ST elevation MI means that the patient gets an automatic trip to the cath lab because they need percutaneous intervention and cardiac stents within 90 minutes. So time is cardiac muscle when it comes to a STEMI, all right? So again, ischemic heart disease, the least severe is up at the top, and that is stable angina. Then we move on down into our acute coronary syndromes, which are unstable angina, non-STEMI, and STEMI. And these are the key features of each. I hope this video has been helpful, and go Vols.